In this third installment video in the ongoing monthly medical series from Dr. Joe Alton and Nurse Amy of the Doom and Bloom YouTube channel, Dr. Joe Alton provides us with some insight into the need to gather medical history for your patients that are under your care and for your preparedness group before a potential disaster occurs. And they're the authors of the award-winning book, The Survival Medicine Handbook, and it's a book that I cannot recommend enough. And they also provide medical gear on their website specifically designed for the preparedness community. And I'll provide links to both of these in the description and comments section below. Also, I'll provide links to the playlist so you can follow along with these video series. Again, the point of these videos is to provide you with a strong foundation for medical preparedness. It's often overlooked, yet it's so critical within the preparedness community. Whether you become the medic in your group or you get someone to take on this responsibility, it's an important asset to have in your team. I'll also provide links to the medical intake forms that Dr. Joe recommends in this video when you go about collecting patient history, so you can print these out in advance. So let's jump in.
For the family or group medic in long-term survival scenarios, success involves knowing a patient's history. The history allows you to figure out what type of medical issues to expect in an uncertain future and assists you in preparing for injuries and illness. The last thing you want is to be blindsided by some medical problem you should have known about beforehand. It's better to take a person's medical history when you're not in the middle of an emergency that renders the patient less than alert. You don't want to rely on family members or even bystanders to give you possibly erroneous information. It's important to compile as complete a medical history as possible for every person in your group before a disaster occurs. In this way, you can help them plan to stay healthy in hard times. For a before they're sick or hurt medical history, consider the acronym MMASH. This stands for medical illnesses, medications, allergies, surgeries, and hospitalizations. You'll want to know about the patient's past and current experiences with chronic conditions, operations, injuries, allergies, and medications, including any side effects. Here's what you ask. What do they consider their general state of health? Excellent, good, fair, poor? What illnesses have they had or have? Cancer, heart disease, hypertension, diabetes, thyroid, just about anything. Have they been hospitalized for any reason? Did they have an injury or surgical procedure? What type? How long ago? Did they recover fully? Are they taking medications? Note the names, dosages, frequency of any drugs, including any over-the-counter medications, supplements, and herbal remedies. Are they undergoing alternative therapies like chiropractic or acupuncture? For what reason? Are they allergic? To what? What kind of reaction did they have? A rash, itching, anaphylactic shock? What made them better? In females, you want to know how many pregnancies they've had. What were the outcomes? Healthy baby, miscarriage, vaginal delivery, cesarean section? Do they have regular periods? In older women, have they reached menopause? Do they take hormones? If working with kids, you might not have a lot of past medical history, I hope, but ask parents about any birth defects or deficits in growth and development. Height, weight, and head circumference are standard data from pediatric records. Note any missed developmental milestones, significant behavioral changes, and learning issues. Immunization history is also useful. If your people aren't immunized, you better know how to recognize things like measles, diphtheria, and chickenpox. You'll also want to know about family history. A family history consists of information about medical issues in direct blood relatives of the patient. If you're the medic, take advantage of family gatherings to talk about health problems. Collect information about your parents, sisters, brothers, half-sisters, half-brothers, grandparents, aunts, uncles, nieces, and nephews. You'll want to know about major medical conditions, when they got them, treatments, and what age perhaps the person was when they died. Many times, family members might not know these things. In these cases, you might get information from death certificates, which can reveal issues you never knew your loved ones had. Knowing a patient's family history helps identify a predisposition to developing certain illnesses, which can help the medic make clinical decisions and may even offer opportunities for prevention. For example, if there's a strong family history of diabetes, you can encourage a healthy diet and exercise now to perhaps prevent damage from type 2 issues. Even knowing racial and ethnic backgrounds can help. African American ancestry, for example, is associated with a higher risk of high blood pressure. You'll also want to know a patient's social history. A social history addresses occupational, recreational, social, and even aspects of the patient's personal life that have the potential to be clinically significant. Is there a history of substance abuse? Note alcohol, tobacco, and recreational drug use, including type, amount, and duration, as well as any past treatment or stints in rehab. Are they still drinking, smoking, or using? How much? Daily? For smoking, how many packs a day for how many years? Occupational history is useful in case there has been exposure to hazards, but it also helps to identify skills and experience that a group member has that could be a survival asset. Might even give you a clue as to the level of fitness of a person. In the same vein, you should ask about hobbies. If running marathons is one, well, you could probably count on that person handling a long hike. Sexual history is another part of social history. You'll have to decide how far to go with that one, but there are circumstances where it's useful medically to know. You might, for example, want to know if someone has or had syphilis, so you can learn and look for both the early and late signs of the various stages of the disease. Then there is what we call the review of systems. The review of systems is an inventory of current issues with the body systems that haven't been revealed yet in your interview. You can go from head to toe if you're doing a first history, or just go into relevant systems if the patient, for example, is dealing with a urinary problem. A thorough review asks about past and current symptoms and treatments. The systems include constitutional signs and symptoms like fever, weight loss, fatigue, eye symptoms, ears, nose, mouth, and throat problems, cardiovascular symptoms, respiratory symptoms, gastrointestinal symptoms, genitourinary symptoms, musculoskeletal and joint symptoms, skin problems, neurological symptoms, allergies, hormonal problems, and even mental health. If someone's hearing voices, you probably want to know. You'll find lots of pre-printed medical history forms online that you could use to document all this information you're gathering. Now, one thing, make sure to always maintain strict confidentiality in all encounters. There's nothing that destroys trust in a healthcare provider than loose lips. That's a good general medical history that'll let you know as much as possible about what's going on medically with your people before they come to you to be examined for a particular problem. Like I said, this is best done before the world falls apart so that you can refine your medical supplies to meet needs and hopefully nip some problems in the bud. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching.
Again, thanks to Dr. Joe Alton, aka Dr. Bones, for taking the time to put this video together. These video series, they're going to build progressively on top of one another, and they were kind enough to break them down into easily digestible, bite-sized chunks. Now, if you have any feedback, any questions, please feel free to post those below. And as always, stay safe out there.